Nowhere is there a more stark contrast between the battle against HIV and the promise of eradicating it than in Kenya. Approximately 150,000 Kenyans die each year of AIDS. An estimated 7% of the country's overall population of more than 32 million is HIV positive, and there are pockets where the rate skyrockets to around 40%. Suba district in western Kenya is one of those areas. Here, HIV is so prevalent that any given member of the population either has the disease, is helping care for someone with it, or a child whose parents died of it. And yet 4 years ago, when IMC launched a program to provide access to care and treatment for some 50,000 HIV-infected people, rates were about 6% higher, at around 44%. In Suba, villages are so remote, so difficult to reach that access to health care and education presents a huge obstacle to preventing and fighting HIV. For IMC, that means hours driving along dusty, rocky, unpaved roads, or traveling by boat across Lake Victoria to reach people who have no other means of receiving care. Among them, Sebastian and Risper. In 2004, IMC tested the couple for HIV, and they were positive. They received treatment as well as counseling on how to avoid transmitting the disease to their newborn daughter. Since then, they have joined hundreds of IMC community mobilizers who reach out to help others with HIV.
The IMC counselors, they told me that I can, even though I'm HIV positive, I can treat my child the way I was counseled, and the baby will turn negative, and I can even help others the way I was treated. Many are afraid to tell their husbands, and through discussion we can share and help each other.
The help Sebastian and Risper received saved their lives and the life of now 3-year-old Salome, who is HIV negative. Their work in turn is saving the lives of those in their community. IMC's programs in Suba are part of an ambitious PEPFAR initiative launched in 2002 with the help of the Centers for Disease Control and Prevention, aimed at tackling HIV on numerous fronts at once. This includes providing home-based primary and mental health care, nutritional support, prevention of mother-to-child transmission, an education and awareness campaign, training for local healthcare workers, and treatment of opportunistic infections such as tuberculosis and malaria.
So they are saying that they are seeing a lot of benefits of coming the HVCT, that is VCT at the homes.
The home visits provide another crucial component in battling a disease like HIV and the enormous stigma attached to it: privacy and specialized, targeted attention. For those living on the remote islands of Lake Victoria, where the primary economic engines are fishing and prostitution, cultural norms make behavior change difficult, and HIV is rampant. If it weren't for IMC, many of the residents would receive no care at all.
It's only IMC that brings mobile services here, which are comprehensive. We have VCT, we have treatment of minor ailments, but this is only once a month, meaning that these people, they stay here without essential health services. This is quite risky, especially when we look at the issues of sanitation. It's quite a big risk.
The people of Suba recognize that mobilizing their community is the key to becoming self-reliant and ensuring their future. In the end, individuals, many with HIV, are reaching out to friends, relatives, and neighbors to educate them about treatment and prevention.
I enjoyed because I feel that I'm not alone, and I want to make them know that they are not alone. Me, I'm very grateful to IMC.